Hello aspirants, welcome to GDC English Classes YouTube channel and welcome to Margdarshan Series for GDC Prime, specially for English batch, that is for students from South India region like Andhra Pradesh, Telangana, Kerala, Karnataka as well as Tamil Nadu. So this is our main intent from GDC to break the language barrier, yes, make access easy to the all students across the India, and that's why we are came with the English language, that is the GDC classes for Gpat, Sniper, Drug Inspector, Pharmacist and other pharmacology exams in the English language also. Okay, so in this Margdarshan series, we starting with pharmacology, that is the introduction to pharmacodynamics. So before going into details of pharmacodynamics, yes, you already know that the new batch is announced for GDC Prime 2025 as well as 26, especially for the English classes for South Indian region pharmacy students. So in this you can get daily live classes throughout the year and 23 plus hard copy books, the modules of GDC exclusively designed by the experts, and 500 plus pre-recorded video lectures and 500 plus online test series and 500 plus daily practice test and 36 plus previous year paper questions. Okay, so for more details you can contact these numbers, and not only that, you can also contact my number also, 799 531 8103, 799 531 8103. So we will start our new batch from 15th July, but before that we are conducting free demo classes for you people. So daily one recorded lecture will be uploaded on our YouTube channel, that is GDC English classes. So subscribe to GDC English classes, share to your juniors, seniors as well as your other pharma related friends. Okay, yes, what is pharmacodynamics? So pharmacodynamics simply pharmacon, drug, dynamics, the power. So it is a study of dealing with effect of drug on body. So how the drug showing its effect on the body in the form of biochemical effect of drug, physiological effect of drug, mechanism of drug action, adverse effect of drug. So biochemical changes, definitely if a drug molecule interacting with receptor, so it may produce some biochemical changes by releasing secondary messengers like cyclic adenosine monophosphate, cyclic guanosine monophosphate, ionocetal triphosphate as well as diacylglycerol. And physiological changes, if adrenaline, a neurotransmitter nothing but drug, binds to beta 1 receptor, it produces cardiac muscle contraction. Mechanism of drug action, for example, the adrenaline on heart increases heart rate. And adverse effect, so continuous usage or excess dosage of drugs may develop adverse effect of the drug, may develop adverse effects of the drug. So these are the different types of effects of drug you can study in the pharmacodynamics. So simply pharmacodynamics, what the drug does to the body. So if any drug enter into the body, what the drug is doing to the body in the form of pharmacological action, that may be beneficial effect, that may be a toxic effect, that may be an adverse effect, that may be a any allergic reaction also, in the form of it generating some energy, some power, some action. Okay, so here you can see there is a flow chart. I will explain, you will get some details here. So here the pharmaceutical phase, so a formulation enter into the body, that formulation undergo disintegration and form disintegration for the purpose of absorption. So what is absorption? From the site of administration to drug reaches to blood, that is absorption. So once absorption completed, then the distribution from the blood, the drug have to reach the target site for action. And once the distribution completed, so the distribution in the form of reversible form of drug accumulation, the drug may accumulate in the tissues to show its action. Once the action completed, once the distribution happen, it should reach active site and it should show pharmacological effects that may be beneficial therapeutic effect, that may be non-beneficial toxic effects. But once the action completed, the drug should undergo metabolism inactivation of drug. Once the drug is become inactivated, it should be eliminated through the urine, kidney. So the pharmaceutical phase nothing but drug administration, and absorption, distribution, metabolism, elimination are pharmacokinetic phase, that is ADME, absorption, distribution, metabolism as well as elimination. Under the pharmacodynamics will be effects. It may be therapeutic effect, it may be toxic effect, it may be adverse effect, it may be any type of allergic reaction. Okay. Next, so mechanism of drug action. So there are many number of drugs. So in the pharmacology textbooks, in the different systems like autonomic nervous system, like CNS, like CVS, like blood, kidney, endocrine, chemotherapy, you can find number of drugs. But the number of drugs are showing their action mainly by one is non-receptor mediated, one is receptor mediated. So let's see the non-receptor mediated. So here there is a no involvement of any receptor, any binding site. So in that the non-receptor mediated, that is by the physical action. In the physical action, there are many examples I gave here. One is osmosis. So through the osmosis, the drug acting is mannitol. The drug acting is mannitol. The drug acting is mannitol. Mannitol is generally using as a diuretic, but it is nowadays mainly for treatment of cerebral edema. Next, adsorption. The activated charcoal for adsorbing excess poisoning. For example, cinchona alkaloid poisoning, morphine poisoning. So, for example, if any person took any poison through oral route, within 20 to 30 minutes, we can bring back that excess alkaloid poison from the GID by using charcoal. So, charcoal having adsorption property. So, charcoal adsorb the poison, and along with emetic, it produces vomiting, and that causes lavage, gastric lavage, cleaning of the stomach due to poison. To control poison, demulcent, the soothing agent. So during the dry cough, we will feel discomfort, we will feel pain, we will feel roughness. So demulcents like cough syrups, they causing smoothness at the throat. Next, radioactivity, the isotope iodine 131 for treatment of a tumor to the thyroid gland. So here in this picture you can see, so this is the a channel. So through this channel the molecules are passing here, from one side of the cell to another side of the cell. So simply this is the osmosis, this is the process of osmosis. Next, after physical action, next is by the chemical action. So by the chemical action, first one is antacids. So antacids are mainly for the purpose of neutralizing the gastric acid. And you know there are many number of antacids in the form of sodium salts, in the form of calcium salts, in the form of magnesium as well as aluminum salts. So these antacids neutralize the gastric acid secretion and control the ulcer formations. Next, chelating agents. So here these are the chelating agents mainly used in the poisoning substance like arsenic poisoning, lead poisoning, mercury poisoning, like that. Okay. So dimercaprol, also known as BAL, British anti-leuciside, for treatment of arsenic as well as mercury poisoning. Next, desferrioxamine for treatment of iron poisoning. And D-penicillamine is an antidote for copper poisoning, especially Wilson's disease. What is Wilson's disease? So Wilson's disease is excess accumulation of copper in the body parts like eye, brain, liver. So D-penicillamine is a basic hydrolysis byproduct of penicillin G, one of the antibiotic. So penicillin G is an antibiotic and its byproduct D-penicillamine for treatment of copper poisoning, that is Wilson's disease. So here it is the chelation therapy. Here it is the chelation therapy. So what is happening here? Here it is the iron molecule and iron compound binds to iron. Iron compound binds to iron. So desferrioxamine is a complex of iron binds with excess iron and that become chelate. The chelates are water soluble, eliminate from the body. So let's see. Chelation therapy is a process for removing heavy metals from the body. It introduces a iron chemical compound into body that can bind to the unwanted heavy metal iron. The compound render means decreases render nothing but decreases the unwanted metal chemically and make it inert by binding to it. Inert means that not having any ability to showing response and allows the metal to safely pass through the body without causing any further harm. Sorry for inconvenience. So simply by the process of chelation therapy, what is happening? Here the excess metal compounds are eliminating through the process of chelation. So chelating substances are water soluble. Okay. Okay. So that is simply about the chelation therapy. So there are many antidotes used as a chelating agents in the poisoning of metals. And next, the drugs acting through the enzymes. So most of the drugs, not most of the drugs, yes, some of the drugs showing their action through the enzymes. So here in the enzyme kinetics, there is a competitive antagonism, non-competitive antagonism as well as uncompetitive antagonism. Let's see in detail. The same topic you can cover in case of receptor antagonism also. So let's see the topic or concept behind here. So here you can observe so the drug being structurally similar compete with the normal substrate for the catalytic binding site of the enzyme so that product is not formed or non-functional product is formed. So you can see this is the inhibitor, this is the substrate and this is the enzyme part. Both are competing for the same site, but if inhibitor is competing with the substrate is unable to interact with the catalytic site and there is a no chance of product formation. So you can see here the picture, this is the enzyme and this is the competitive blocker already bind. Because of binding of competitive blocker, the substrate is unable to bound and there is a no reaction. So here it is the enzyme, here this is the competitive substrate, sorry antagonist. Because of antagonist there is a no substrate binding and ultimately there is a no reaction, no product formed. So the example you can see, physostigmine and neostigmine compete with acetylcholine for choline esterase, acetylcholine esterase. So physostigmine, a natural alkaloid from the Physostigma venenosum, belong to the family Leguminosae, also known as Fabaceae. And physostigmine comes under indole alkaloid, chemical indole alkaloid. So biosynthesis from the tryptophan amino acid. Okay. And here neostigmine is a semi-synthetic derivative which can widely used in treatment of myasthenia gravis because it can directly stimulate the neuromuscular junction on the skeletal muscle and promote the muscle contraction. So these two drugs competing with acetylcholine and prevent the acetylcholine metabolism by acetylcholine esterase helps in the treatment of Alzheimer's disease. And another example, allopurinol compete with hypoxanthine for xanthine oxidase. So allopurinol is a drug helps in the treatment of gout. As you know, gout is excess or continuous accumulation of uric acid crystals in the joints of the body. Joints of the body. So this is competitive antagonism. Next is the non-competitive antagonism. So in case of competitive antagonism, both substrate and inhibitor competing with active site, catalytic site. But here the inhibitor reacts with adjacent site but not with catalytic site. Adjacent site means allosteric site, which is other than active site. But due to the inhibitor binding to allosteric site, nothing but non-catalytic site, the size of enzyme changed. Because of change in size of enzyme, the substrate is not fitting, so there is a antagonism is achieving. So inhibitor reacts with adjacent site, that is allosteric site other than active site or catalytic site, but not with catalytic site, that is allosteric site, but alters enzyme in such way that loses its catalytic property, So you can see clearly this diagram. So this is the inhibitor binds to the enzyme and this is the substrate, but substrate is not binding here because of due to binding of this inhibitor, the enzyme function changed, the morphology of enzyme changed, and the substrate is unable to bound. So in case of competitive, both the substrate inhibitor competing with the same active site, catalytic site, but here in non-competitive, the inhibitor binds to the allosteric site other than active site, but because of that the morphology of enzyme changed and substrate is unable to bound and product is not forming. So you can see simply here, this is the substrate, and this is the enzyme. When inhibitor is bind, there is a no substrate is bind, so no product formed. So non-competitive inhibitor has equal affinity for free enzyme as well as enzyme substrate complex. Example of non-competitive: aspirin indomethacin inhibit COX enzyme, disulfiram inhibit aldehyde dehydrogenase enzyme. So disulfiram inhibit aldehyde dehydrogenase helps in the alcohol de-addiction, and digoxin inhibit the sodium potassium ATPase enzyme and helps in the treatment of congestive heart failure. Theophylline inhibit phosphodiesterase enzyme. It may cause a stimulation of the CNS, central nervous system stimulant. Next, uncompetitive antagonism. So what is this uncompetitive antagonism? Here enzyme substrate complex is formed. To that enzyme substrate complex, the inhibitor will bind. It is also known as anti-competitive. So wait a moment. So this type of antagonism is also known as uncompetitive, nothing but anti-competitive. Inhibition takes place when an enzyme inhibitor binds only to complex formed between enzyme and the substrate. So here enzyme substrate complex is formed. To that complex the inhibitor binds. So you can see here, this is the complex between substrate and enzyme. To this complex the inhibitor is bind. So uncompetitive inhibitor binds only to enzyme substrate complex. So I will give some example, I hope you can understand. For example, you are writing exam, you are having copy, copy slip. So you are the enzyme, your slip is the substrate, your complex is formed. But if invigilator is came, you unable to perform, you unable to copy from your slip. So you and your slip complex, enzyme substrate complex formed. To this enzyme substrate complex the inhibitor invigilator bind, then you unable to copy, so there is a no action. That is uncompetitive, nothing but anti-competitive enzymatic antagonism. Okay, so here in the enzymes you can observe the terminology like Vmax. What is Vmax? Maximum maximum reaction velocity, the maximum speed of reaction at which all enzyme become saturated with the substrate, and the Km is substrate concentration at which half of maximum velocity is achieved. So substrate concentration at which half of maximum velocity is achieved, that is Km. So we can determine Vmax and Km for a reaction, any enzymatic reaction, by plotting graph of rate of reaction versus concentration of the substrate. Concentration of the substrate. Okay. So by using these constants, and these constants are by 𝙂𝙀𝙎𝑃ℎ𝑎𝑔 equation. So let's see what are the Km as well as Vmax in the different enzymatic kinetics. So in uncompetitive antagonism, let's see. So the Km is decreasing, Vmax also decreasing. When coming to the non-competitive antagonism, Km is the same, Vmax is decreasing. And when coming to the competitive antagonism, the Km is increasing and Vmax is the same. So the Km Vmax nothing but explained by 𝙂𝙀𝙎𝑃ℎ𝑎𝑔 equation, and here Km is the 𝙂𝙀𝙎𝑃ℎ𝑎𝑔 constant. And let's see, we have a glance on this enzymatic kinetics. So in competitive, enzyme binder, so inhibitor is competitive inhibition and binds to enzyme, and Km increases, no change in Vmax. Example, 𝙂𝙎𝑃ℎ𝑎𝑔, that is competitive antagonism. In non-competitive antagonism, both enzyme and inhibitor binds to both enzyme and enzyme substrate complex. No change in Km, decrease in Vmax. Example, cyanide. Uncompetitive antagonism, inhibitor directly bonds to enzyme substrate complex, decrease in Km as well as Vmax. Example, lithium. So regarding enzyme inhibition, the competitive inhibition, you can see the inhibitor directly bonds to active site. In case of non-competitive, inhibitor binds to allosteric site, that is other than active site. And uncompetitive inhibition, the inhibitor bonds to enzyme substrate complex. So the enzyme substrate complex is formed and inhibitor bonds to the enzyme substrate complex. And here the non-competitive inhibitor bonds to allosteric site and substrate binds to active site. In competitive inhibition, the inhibitor binds to active site of the enzyme. Yes, here this is a GDC prime, the details of GDC prime. Yes, from July 15 we are starting the Gpat classes for South India pharmacy students in the form of GDC prime. So these are our list of the faculties. For all subjects who all are qualified in Gpat as well as NIPER, and definitely our experience as well as our strength definitely help you to get out of your competitive orientation. Nothing but we can easily crack the Gpat as well as other pharma competitive exam, and it's our responsibility to help you as well as to motivate you. Yes, some of the drugs are acting through the ion channels. So, example like local anesthetics. So, local anesthetic blocks voltage gated sodium channels in the neuronal membrane to produce local anesthesia, loss of sensation at local area. So, examples like cocaine, procaine. Cocaine was first local anesthetic. It is naturally from the 𝘖𝙁𝑥𝑦𝑙 coca, belong to the family 𝘖𝙁𝑥𝑦𝑙aceae. Cocaine can stimulate CNS, may cause addiction. Cocaine can also stimulate the cardiovascular system. And some of the drugs like vaccines acting by producing antibodies, and some of the drugs showing their action by transporters. For example, selective serotonin reuptake inhibitor SSRI binds to serotonin transporter and block the reuptake of serotonin from postsynaptic neuron to presynaptic neuron, increase the availability of serotonin at postsynapse, and produces antidepressant effect. What is depression? The depression is a CNS related disease. It is because of decrease in catecholamine levels in the brain. So to make the person removal of depression, free from depression, we have to increase catecholamines like serotonin, noradrenaline, dopamine in the brain. Okay. Here, selective serotonin reuptake inhibitor inhibit the serotonin transporter and prevent reuptake of serotonin from postsynapse to presynapse, increase the availability of more serotonin at postsynapse, and helps in the treatment of depression. Helps in the treatment of depression. Next, after completion of non-receptor mediated, next is the receptor mediated. Next is the receptor mediated. So let's see. Receptors are the chemical structures composed of protein, receive and transduce signals that may be integrated into biological system. So receptors are nothing but protein molecules. When receptors occupied by ligand drug molecule, they receive the signal and pass the information into the cell and generate biological function, physiological function. And simply, receptors are macromolecules present either on cell surface or cytoplasm or in the nucleus. So simply, drug binds to receptor and form drug receptor complex. So here, affinity, ability of a drug molecule binding with the receptor. Ability of a drug molecule binding with the receptor, affinity, and once binding with the receptor, ability to generate pharmacological or physiological or biological action is efficacy or intrinsic activity. That is intrinsic activity or efficacy. For example, adrenaline is ligand molecule on beta 1 receptor in the heart. So binding of adrenaline on beta 1 receptor of heart is affinity. After adrenaline binding to the receptor, it may increase the muscle contraction of heart. That is efficacy, intrinsic activity, biological activity. So as I mentioned earlier, affinity is ability of a drug molecule binding with the receptor. Receptor nothing but binding site. Intrinsic activity, ability to produce action after binding. Once bind to the receptor, it should produce action. If there is no affinity, no intrinsic activity. If there is a no affinity, if drug molecule not binding to the receptor, no action generated. If you are not attending the exam, you are simply failed. All drugs have affinity but with different intrinsic activity. So all students can write the exam, but they are getting different marks by their performance. So there is a agonist, there is a antagonist, there is a partial agonist, there is inverse agonist, all having affinity but producing different action. For example, affinity. So here you can see the concept of affinity, potency, efficacy. So the drug binds to the target, once binds to the target, shows effect. So affinity, ability of a drug molecule binds to target. Efficacy, after binding to target, shows action, that is effect. So tendency of drug binding to the target, that is affinity. Ability of the drug to generate action. And what is the potency? Relative dose of drug required for desired effect. The amount of dose required by a drug to produce its action. So let's see affinity. The key fits into the lock. However, the key does not unlock it. The key drug has affinity for the lock receptor. So it is the binding site, that is receptor. The key nothing but drug ligand molecule. Yes, here the drug nothing but ligand molecule fit into the receptor, but it is not properly fit. That's why it does not generate action. You can see clearly here it is the key nothing but drug. Here it is binding to the receptor and fitting into the receptor generate the action. That is conformational change. So fitting is important. That's why lock key model is discussed clearly. Next, based on intrinsic activity, the drugs are agonist, have both affinity, maximal intrinsic activity as a +1 or +100. Partial agonist, having affinity but half of action of agonist, that is 0 to +1, that is 0 to 50 also. Inverse agonist, having affinity but opposite action to agonist, that is the intrinsic activity negative. So the agonist positive action, inversion opposite inverse agonist negative. Antagonist, neutralizer, having affinity but zero action, neutralizer. So you can see when agonist molecule bind to the receptor, there is a full activation. When both agonist antagonist competing with the same receptor, there is a less activation. If only antagonist targeting the receptor, only antagonist targeting the receptor, then there is a no activation. Then there is a no activation. So here it may be agonist, it may be antagonist, it may be inverse agonist, it may be partial agonist. Every drug molecule having the affinity, they have to bind to the receptor. Every student should attend the exam, but based on their performance, they will get good marks, medium marks, low marks. So here, every substance having affinity, but for example, full agonist shows 100% action. So having a good conformational change with receptor binding. Partial agonist. So the partial and full agonist may be differ by the dose. So full agonist 100%, partial agonist 50%. And neutral antagonist. So, for example, propranolol. Propranolol is a non-selective beta blocker, blocks beta 1 receptors in the heart, control hypertension. When propranolol block beta 1 receptor, then the adrenaline unable to bind to beta 1 receptor, slowly hypertension decreasing. Here, antagonist just binding, but because of that binding, the adrenaline unable to bound to heart, hypertension decreasing. So antagonist is a competitive molecule, compete with the agonist and prevents binding of agonist to the binding site, receptor site. Okay, next inverse agonist. Inverse agonist shows action in -1. The inverse agonist example is beta carbolin. So here it is a agonist. Activate a receptor to produce similar effect. For example, acetylcholine shows agonist action on the muscarinic receptor. Adrenaline, agonist action on the beta receptor. Dopamine, agonist on the dopamine receptor. Antagonist, prevent the action of agonist but does not have any effect on its own. Propranolol, block beta 1 receptor. Naloxone, block opioid receptor. Okay. Atropine, block muscarinic receptor. Partial agonist, produce the submaximal effect of the agonist but antagonize the action of full agonist. So full agonist 100%, partial agonist 50%. The example of partial agonist, buspirone, a serotonin type 1A receptor agonist for treatment of anxiety. Next, inverse agonist, produce an effect in opposite direction to agonist. Produce an effect in opposite direction to agonist. Yes, this is the news for you. The fees also reduced. The classes from July 15 for English language for South India students, the fees is 10,200 only. It is not 12,000 or 13,000. Okay. So here the benefits you are getting, the Gpat at fingertips. So from this fingertips book only, nearly 100 plus questions are came in the Gpat 2024 examination. So Gpat at fingertips theory book as well as MCQs practice book you will get, and daily live classes up to 500 plus throughout the year, 500 plus daily practice paper, 500 plus video lectures already present in the app. 500 plus online test series and 35 plus previous year question paper like Gpat and ebooks available in our app, that is GDC. So download our GDC app from the Play Store and also subscribe to GDC English Classes YouTube channel for more details. So come and join with us and taste the success in the pharma competitive field. Okay, thank you. Subscribe to GDC English Classes, and this is the Margdarshan series. So from the 22 June up to July 7th. Okay, the real classes will be start from the July 15th. So inform to your juniors, your seniors, your classmates and other your known persons from the pharmacy field who are preparing for Gpat, NIPER, drug inspector as well as other pharma competitive exams. Okay, thank you. Yes, not only here given numbers, you can contact me also if you are from South India region, because I am the coordinator for GDC in the South India region, especially English classes. So you can call me on 799 531 8103. Okay, I will write my number here. You will get some clarity. Right, a moment. Yes, myself Ashok Kumar. I completed my B Pharm from Andhra Pradesh Chalapati 799 531 8103. This is my mobile number. You can contact me also. And I completed my B Pharm in 2013, and after that I went to NIPER in UP, that is 𝘎𝙬𝙬. I completed in 2015 and still then I am in the teaching field. So I am very passionate to give Gpat classes, nothing but pharma competitive classes to students. And definitely if any student giving positive feedback, yes sir, you are great, you are excellent in the pharmacology, that is more satisfactory thing for me. Yes, you can contact me on 799 531 8103. So subscribe to our GDC English classes. Thank you.